The question that I want to answer today, which is often posed by some individuals, is whether emotional trauma can cause physical pain. Right away, I want to answer, not really, but it gets complicated. So I want to get into this topic. Just to review, I'm a physician trained in psychiatry as well as pain medicine and addiction medicine. And I used to direct the chronic pain rehab program at the Cleveland Clinic and continue to see chronic pain patients with psychiatric and mental health concerns as well as addiction in my current clinic. And I've drawn from that experience various lessons. I've also done some research on this topic, the relationship between, for instance, trauma and physical pain. So getting back to the question, emotional trauma doesn't really cause physical pain, but it's important, it's related. It's what we call a risk factor. If individuals have had trauma, not just emotional, but physical trauma of any sort in their early adulthood, in their early development, and that impacted them sufficiently, it can be a risk factor for later developing chronic, disabling, and complex pain. So, if you think about it, this is something that actually shapes somebody's not just psychology, but actual nervous system. We've seen that those individuals who unfortunately go through a car accident, a surgery, some other injury, and then develop chronic disabling pain have had often, not always, but often, pre-existing risk factors. One of those risk factors is trauma. That could be in childhood, early adulthood, or even just a traumatic psychological experience of the event itself. So as we meet individuals with chronic pain that's very difficult to treat, that doesn't get better with standard treatments, we ask ourselves, what were the risk factors in this individual? We ask ourselves, if you get 100 individuals and they have the same or similar car accident, injury, surgery, not all of them are going to have chronic disabling pain. In fact, the majority of humans are going to bounce back, thankfully, and they're going to heal. But there are a select few that are going to have certain risk factors. Aside from trauma, we'll revisit that in a second, there are other risk factors. We call it genetics or genetic loading. Maybe there's a family history of neurologic disease or chronic pain. There are aspects of the injury or medical process that are risk factors. For instance, if somebody has other medical conditions that contribute to things like inflammation, poor healing, that can influence if somebody develops chronic, lasting, complex pain. So there are a whole host of other factors to think about, but for the question posed, if we were to focus on trauma, it is important, but it's not alone the thing that causes chronic physical pain. I do want to talk a little bit about my work in this space. In 2019, I published a paper called Parallel Pains. It's an article that you can read if you'd like, where I talk about how trauma doesn't really cause physical pain, but it sort of coexists with physical pain in many individuals, and it's important to attend to both. We want to get away from splitting up the mind and the body and thinking trauma causes physical stuff causes mental trauma. It's all very much more connected than we normally appreciate. And instead of thinking them as separate or one causing the other, it's very important to treat them both equally and balance them out. This is why I use the term parallel pains. And in the article, I talk about how different individuals with trauma and ongoing stressors, meaning things that are really challenging in their life, have these kind of parallel pains to their physical pain. I have 3 examples in the article of individuals with real life chronic disabling pain and parallel psychological or social pains that are also important to attend to. These can be stemming from trauma or other hardships. It's important to balance this out if we're going to have any fighting chance in helping individuals with chronic disabling pain. And this is how I actually leverage my identity as not just a pain physician, but also psychiatrist in helping individuals with both of these tasks at once. one thing that I represent in that article that would be important for individuals to think about is how each of us have brains, but each of us also have minds. And in those minds, we have inner psychologies. They're very complex, right? Everything we've been through, our development, our traits, our tendencies, what we like, what we don't like, all of that psychological mumbo jumbo, if you will, is really critical to try to understand. In the article, Parallel Pains article that I mentioned, I delve into what we like to call dynamics. Dynamics are kind of psychological forces or variables that kind of play off of each other. So for instance, somebody may have a lot of anxiety about something, but then they have what's called a defense. A defense means a coping strategy or a way to deal with that anxiety. Anyway, these dynamics, which are very complex, are important to try to understand in an individual who has chronic disabling pain. And the dynamics fall into two different categories, which are represented by two different triangles, a red one and a blue one. We have intrapersonal dynamics. That means things within our own psychology, right? So our own tendencies, traits, coping mechanisms. But then we also have interpersonal dynamics. That means kind of how we dance or what our dynamic is with other people. It's really important, interpersonal dynamics. This is where, for instance, early relationships might have been very important, and they shape how you see the world, how you see future relationships, how you see your doctor, how you see the healthcare system at large. These are dynamics or dances, if you will, interactions, relations that are really important to attend to understand how individuals navigate healthcare or just seeing their chronic pain doc, for instance. Intrapersonal and interpersonal dynamics are really important to understanding those parallel pains. So, where does trauma fit into all of this? As mentioned, if somebody has had early trauma, that's going to shape them, not just psychologically, and being afraid of something that, for instance, resembles something scary from the past, but also at a level that they may not even appreciate or be aware of. It may shape their neurological system. So here's where we get into the neurobiology of chronic pain. It turns out that individuals with chronic pain that's lasting for years and only getting worse with time and doesn't respond to any treatments, they typically have something called central sensitization. That's fancy speak for your central nervous system being kind of on high alert, sensitized. Central nervous systems are composed of our brains and spinal cords. If you look at how pain circuitry operates, it's not just your hand or your belly or your back that's hurting. It's actually a complex circuit or a loop that's going from those areas up the spinal cord into the brain and then back down. So it's a complex circuit with a lot of moving parts. And it's important for patients to appreciate that. As you navigate the healthcare system and you have chronic pain, the natural tendency is to go see a gastroenterologist if your belly hurts, a spine doctor if your back hurts, an orthopod if your leg hurts, etc. And that's all good, and you should not discard that. But if you don't attend to that central nervous system, you might be missing a big part of the puzzle, particularly with chronic, complex disabling pain. So back to trauma. Trauma actually has been shown to centrally sensitize individuals. What does that mean? That means that unfortunately there are hormonal changes at the time of early trauma, or worse, chronic trauma, that impact how that nervous system then adapts over time. And so now you have years later a very sensitized nervous system. Unfortunately, that sensitized nervous system can be quietly simmering, and then when an incident occurs, a car accident, a surgery, an injury, suddenly it sort of explodes, if you will, erupts, and now you have severe pain that is not behaving or responding to treatments like most pain, and it can transition into chronic disabling pain. So trauma is relevant. It's important. Does it cause it alone? No. But it sort of sets up a template of risk, if you will, and mixed with other factors can result in chronic disabling pain. Not attending to that trauma, although we can go back in time machines, but we can't we can't ignore the residue of that, the effects of trauma. So this is where, again, going back to the parallel pains part, we need to understand how people are sort of built psychologically. That's also stemming from the trauma and development that's early on. We can do something about that. That's where therapies, counseling, and other strategies might help unlock the sort of mental and psychological mystery that is at play in the chronic pain patient. So in summary, to answer the question, emotional trauma cannot by itself cause physical pain. However, emotional trauma, or really any significant trauma, can shape our bodies, our nervous systems, and our psychologies to then emerge from acute pain to lasting, chronic, complex, disabling pain. So, trauma is important for us to attend to, as well as the psychological effects of trauma. I'm Dr. Javier Jimenez, or Dr. X. Follow me for more conversations about emotional trauma and physical pain.